Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professionals. And today we're talking again with Dr. Wesley Shankland of Lima, New Bremen, and Dental Associates. So welcome back.
Good morning, George.
So, what do you want to talk for this?
Well, you know, you remember, I think it was the late 50s or very early 60s, that song, All I Want for Christmas Is My Two Front Teeth.
Yeah.
And actually recorded, it was on the hit chart, you know. Yeah. And I'm not going to be silly about that, but a lot of people have missing front teeth, and there are really great ways to repair and replace those missing front teeth easily. In Lima Dental Associates, all the doctors and staff are very well trained to do that. Now, in the past, there have been all kinds of ways. Today, George, the standard of care is implants. Mm-hmm. If we can place an implant where a tooth is missing, for example, we can place the implant, a titanium rod, or sometimes a screw, depending on what you're using. I place zirconia implants, which have no metal in them, into the bone. Once it heals, you can put a crown on that implant, and it functions just like a natural tooth. You would never know it wasn't a natural tooth. You brush it, floss it just like a natural tooth, and you chew on it like a natural tooth.
So this is perhaps the most popular way to get it.
The most popular way today. Now there's various kinds, and sometimes it depends upon the anatomy in the area. There also, we can place a bridge. Now a bridge is we have to maybe reduce the structure of a tooth on either side of the missing space. So that's the advantage of the implant. You don't have to reduce or cut down other teeth. You just put an implant where the missing tooth is. You can also use a removable partial denture, and sometimes we use that as a temporary measure until we either place an implant or while the implant is healing in the bone. It has to sit there, certain kinds generally 6 months or so before we can put the crown on it.
It is a longer process.
Yeah, it is, but it can be done very safely, very effectively, and we've got some people well-trained, very well-trained at Lima Dental Associates that can do that in all our offices. And it's a nice way, it's a standard of care today. Once it's finished, you cannot tell if it's a natural tooth or an implant.
Okay. Well, they said that just about everybody is available to discuss this thoroughly for you.
Just call our office. We're glad to see you discuss the ramifications and how to do it.
Said some restrictions do apply.
Well, some restrictions do apply. Depends on the anatomy. And that's what we have to see before we can talk to you over the phone about it. We have to examine you, see what kind of anatomy restrictions may be.
Okay. Thanks, bud.